Welcome to Pharm Mini number 15, Antifungal Medications. Antifungal medications consist of myobacterial, which can be broad spectrum or specific, antifungals, and antiprotozoan medications. The indication of antimycobacterial medications is to treat tuberculosis. Antiprotozoal can treat some STIs that are fungal in nature, C. diff, surgical prophylaxis, and H. pyloric infections. And then antifungals can be used to treat fungal infections, especially candidiasis or thrush, ringworm, fungal infections of the nails. The way that these work is antimycobacterial can prevent the synthesis of cell wall components, particular myocolic acid. The broad spectrum antimycobacterial medications also inhibit protein synthesis. Our antiprotozoals are bactericidal, so they kill the bacteria or protozoan against anaerobic microorganisms. And then our antifungals cause cell death by interfering with the cell membrane of the fungus, and it can be fungostatic, meaning that it reduces the spread of the fungus, or it can be fungicidal, where it kills the fungus. To start off with antimycobacterial medications, our broad spectrum would be rifampin, and our selective would be isoniazid, pyrazinamide, ethambutol, and rifampicin, not to be confused with rifampin. The side effects of rifampin is it can cause orange urine as well as like orange body fluids like sweat and tears. It can also cause GI discomfort. More adverse reactions of rifampin would be hepatotoxicity and colitis. Rifampin does interact with oral contraceptives, so we would want to educate them to use another form of birth control. It can interact with warfarin, HIV medications, and isoniazid, which is a more selective form of an antimycobacterial. As far as selective antimycobacterial medications go, the main side effects that we see is peripheral neuropathy, hyperglycemia, and possible hepatotoxicity. It does interact with both phenytonin as well as tyramine foods. So we would want to educate our patient on proper diet without tyramine foods. So that would be no aged meats, aged cheese, fermented fruits, wine, alcohol, and anything else that may contain tyramine. It is contraindicated in pregnancy, and as a whole class, we would want to educate them on what's safe in pregnancy, what's not, again, to use that alternate birth control if they're taking a selective form to monitor their diet and have no alcohol. And for both forms, we would want to monitor liver function. Then we have our antiprotozoal medications. The most common one that we will use is metronidazole. The main side effect for metronidazole would be GI discomfort, a metallic taste in the mouth, a darkening of urine, and extremity tingling and numbness. More severely, it can cause colitis as well as seizures. It does interact with alcohol, warfarin, phenytoin, and lithium, and it's contraindicated in those that have kidney disease, cardiac disease, and seizures. It is safe to take in the second and third trimester of pregnancy, but not the first. Then we have our antifungals, which end in azole, and this is ketoconazole, fluclocysteine, nystatin, miconazole, clotrimazole, and fluconazole. Side effects would be thrombophlebitis, electrolyte imbalances, menstrual irregularities in women, and then in men, we can see gynecomastia, which is growth of breast tissue, decreased libido, and erectile dysfunction. As far as adverse reactions go, they can develop bone marrow suppression, which would mean that it's contraindicated in anyone that is neutropenic. It can cause hepatotoxicity and nephrotoxicity, so it should not be given in anyone that has kidney or liver failure, and it can cause infusion reactions. It does interact with aminoglycosides and other azole antibiotics. In addition to what I mentioned, they're contraindicated in pregnancy, except for amphotericin B and terbinafine. As far as nursing education goes, amphotericin B is a very toxic medication, so it should be used as a last resort. And if an infusion reaction does occur and is not life-threatening, We would want to provide the patient with Benadryl and Tylenol. And that wraps up our discussion on antifungal medications.